Today, we're diving headfirst into one of the most intense situations you can imagine, a high-stakes medical emergency. We're going to break down what happens when every second counts, looking through the eyes of the clinical team that has to solve the puzzle when a life is literally on the line.
Just picture it for a second. That piercing alarm goes off. Adrenaline just floods the room. In that moment, chaos is your biggest enemy. The only thing that's going to win is a clear, systematic plan. Every single tick of the clock is a chance to change everything. So, where do you even start in all that chaos? You start with the primary survey. Now, this isn't some relaxed checkup. This is a lightning-fast, methodical assessment. Its only goal, find and fix the things that will kill the patient right now. It's the absolute bedrock of emergency response.
The mantra here is simple, A, B, C. First step is A, for airway. Is the patient awake? Is their airway clear? And if you have any reason to suspect a neck injury, you're stabilizing it at the exact same time. Then you move to B, for breathing. You're not just checking if they're breathing, you're checking how. Is it too fast, too slow? Are they struggling? You're looking for things like cyanosis, that scary bluish tint to the skin, which tells you oxygen is not getting where it needs to go. This whole structured approach, which continues with C for circulation, is what prevents a critical clue from getting lost in the noise.
Okay, so the immediate life threats are under control, for now. The real investigation begins. The patient has chest pain, so the number one suspect is the heart. And the first tool you're going to grab is the electrocardiogram, the EKG, to get a direct look at what the heart is doing electrically.
And you know, a huge crisis like this often starts with a long, slow-burning problem. And that's what we're seeing here, atherosclerosis. Over many years, plaque builds up and hardens inside the arteries, making them narrower and narrower. If a piece of that plaque breaks open, a blood clot can form right on top of it, and bam, it blocks off blood flow. That's a heart attack.
So, the EKG is basically our translator. It listens to the silent electrical signals that orchestrate every single heartbeat and turns them into a visual story, that waveform you see on the monitor. By reading that story, clinicians can pinpoint exactly what's going wrong.
And to get an accurate story, the setup has to be flawless. This shows where all the EKG leads have to go. And believe me, getting this right is beyond crucial. Each lead gives you a slightly different electrical snapshot of the heart. If you mess this part up, the information you get back is useless. It's truly a garbage in, garbage out situation.
And here is the payoff. Look at that difference. On the left, that's a nice, calm, predictable, normal sinus rhythm. But on the right, whoa, that is ventricular tachycardia, or VTach. The heart is beating so fast, so chaotically, that it doesn't even have time to fill with blood. It's basically just quivering instead of pumping. This is a lethal rhythm. Seeing this on the monitor tells the team the situation just got a whole lot more serious.
Okay, so we have the electrical picture from the EKG, which is huge, but what's happening on a chemical level inside the body? To really understand the crisis, you've got to look at the body's internal chemistry.
And that's the big question, right? The heart doesn't work in a bubble. Its function is tied directly to the balance of oxygen, carbon dioxide, and the pH level of the blood. So to get that piece of the puzzle, we need to analyze the arterial blood gas, or ABG.
This is our baseline, our cheat sheet for what a healthy system looks like. The pH tells us if the blood is too acidic or too alkaline. The PaCO2, that's the respiratory part, handled by the lungs. And the HCO3, or bicarbonate, that's the metabolic side of things, managed by the kidneys. If any of these numbers are out of whack, it's a massive clue.
So how on earth do you make sense of these numbers when the pressure is on? Well, clinicians have these really clever shortcuts, and one of the best is the tic-tac-toe method. It's a simple grid for acid, normal, and base. You just plug in the values, and whichever two line up tells you instantly if the root of the problem is with the lungs, respiratory, or with the body systems, metabolic. It's a really slick way to solve a complex puzzle, fast.
All right, with a diagnosis starting to take shape, a major cardiac event that's throwing the whole body into chaos, it is time to act. It's time to launch the pharmaceutical counterattack, using very specific drugs to stabilize the patient and save that heart muscle.
First up, you've got nitrates. Their job is to open up the blood vessels, to dilate them. This does two key things. It eases the heart's workload, and critically, it helps more blood squeeze through those dangerously narrow arteries to feed the starving heart muscle. That's what helps relieve that awful chest pain.
Next in the arsenal are beta blockers. If you think of the heart as an engine that's redlining, a beta blocker is like gently taking your foot off the gas. It slows the heart rate down, which in turn lowers how much oxygen the heart is screaming for. It's all about protecting the heart from more damage.
And finally, you have to attack the root cause of this whole mess, the blood clot. Anticoagulants, you might know them as blood thinners, are sent in to stop that clot from getting any bigger and to prevent any new ones from forming. This is absolutely essential for restoring blood flow.
So the patient is stabilized, but the journey is far from over. The focus now pivots to recovery and to managing all the risks that come with bigger interventions like surgery. And this is where systems and protocols become everything.
The operating room is a place of incredible precision, and it's built on layers and layers of safety nets. There's the surgical timeout, a mandatory hard stop where the entire team confirms they've got the right patient for the right surgery on the right side. They do obsessive counts of every instrument and sponge. Communication follows a rigid format called SBAR to make sure no detail gets missed. They're even ready for super rare disasters like malignant hyperthermia, with the antidote dantrolene always within arm's reach.
After surgery, the patient goes to the PACU, the post-anesthesia care unit. And here you can see how the priorities shift. Right at first, it's back to the absolute basics: airway, breathing, circulation. But as the patient starts to wake up, the focus transitions to the next phase: managing pain, preventing complications like new clots, and getting them up and moving as soon as it's safe.
This quote really just sums it all up, doesn't it? None of this life-saving work happens because of one person. It's the result of a highly tuned team using proven plans and communicating with absolute clarity at every single step. That is the foundation of safe care.
So when you look back at the whole thing, from the primary survey and the EKG to the blood gas numbers and the surgical protocols, it's just an ocean of data, isn't it? But the ultimate skill, the real art in all of this, is to take all of those data points and find the human story sitting right in the middle of it all. It's about taking care of a person,